0710. Noah and Ed are taking the calls tonight and running the studio and doing a great job. Here we go.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back and talking about ways to live better. Let's talk about ways to help the next generation. So how do we help prevent cancer in the next generation? Well, a lot of things we know about. Not to smoke, not to drink in excess, keep your weight, exercise, stay out of the sun too much, wear sunscreen. Well, those things we know. But did we know that this human papilloma vaccine, if we give to our children, can help prevent cervix cancer, penis cancer, and other cancers? Most cervix cancers are related to human papilloma virus. Many women get, thousands in fact, get cervix cancer related to a virus, the human papilloma virus. There's even information that head and neck cancers, cancers of the throat, like Michael Douglas alluded to having human papilloma virus from oral sex, gave him his throat cancer. So there's now a vaccine available, and it's recommended that our children, young people, have this vaccine, both boys and girls, to help prevent cancer in the next generation. So I know it's a delicate topic to take an 8 or 9 or 10-year-old to a doctor, and we're telling them that we're going to help prevent sexually transmitted diseases in the future. I know it's delicate, but it may be some conversation that you want to have with your doctor or your pediatrician to help prevent this terrible disease from coming in your children. So I highly encourage you to have that conversation, read about it, human papilloma vaccine, and hopefully it can help you. I had an interesting call from a gentleman, and I actually saw him this week. He's been juicing for 8 years, and he said he's doing great. Well, if he's juicing for 8 years and doing great, why is he calling me? Well, that's a good question. Well, he's calling me because, number one, impotence, and number 2, high PSA. And in fact, he had a form from the hospital with about 50 medical conditions that he had, from hernia to high blood pressure to herniated disc to back disease to arthritis. All these things. Well, we know hospitals like to exaggerate the illnesses because they get paid more. So if you ever see your hospital chart, you may get a list of everything from hair loss to hearing loss, etc. But this man, I said, if you're feeling so great from juicing, why are you calling me? Well, the fact is, you might feel great from juicing, but if you look at the data, and how do you know if juicing or vitamins or something really helps you? Well, you want to look at a randomized experiment. You want to take 1,000 people, and half do juicing and half don't do juicing, and then see what happens. Who develops cancer, and who develops this, and who develops that. Well, this man, anyway, despite juicing and having a beautiful body, which he has, he's lost a lot of weight on juicing, but he still is impotent, and he has a high PSA, and he needs medical attention, and we're going to give him that attention that he needs. So, juicing is one thing, but medical care, proper medical care, is something else, and that's what we intend to provide to this man. But another man who's coming in on hormones for advanced prostate cancer, and he wants to try to prevent painful enlargement of his breasts. So how do you do that? Well, probably the best way, if you're taking hormones for prostate cancer, is to give a little radiation to the breast buds in the men, and we do that, just a couple shots to the nipple area only, and that most likely will prevent the painful enlargement of the breast, so the man doesn't develop breasts like a counterpart woman. So most men don't want that, obviously. Many men probably don't know about how to prevent painful enlargement of the breast on hormonal therapy. But if you have questions, you're welcome to give us a call or come in, and hopefully we can stop it in the bud, in the breast bud, or wherever else. And we have another woman who came this week. I've talked about her over the last several weeks because she's so interesting. This is a woman, about 60-year-old black woman. She went to a big hospital emergency room because she lost weight and had terrible pain in the shoulder. They checked her out and sent her on her merry way. Well, part of the problem is when you go to the emergency room, you don't really have your own doctor. You probably don't even know who the doctor is. You probably don't know how to find the doctor. When a patient comes to us, they know how to find us day or night. We feel responsible to the patient. And sometimes, often, the patient even feels responsible towards us. Well, this woman came to us. I was very suspicious. 40-pound weight loss and terrible pain in the shoulder, to me, sounded like something pretty bad. We got scans. We found a cancer in her lung that was eating through the ribs. It actually spread to the lymph nodes in the center of the chest, blocking the airway so much the lung was collapsing because air couldn't get into the lung, and the cancer spread to the adrenal. So easily enough, a biopsy was done, and we started radiosurgery, which is pinpoint radiation to hit the cancer where it was eating through the ribs and where it was closing down the airway, and voila! Within just a few treatments, the pain is pretty much gone. Now, before, she was on narcotics, and it wasn't doing the trick. With radiosurgery, with a few treatments, we were able to stop the pain, get her breathing better, get her back on the road. Now she's smiling. Before, she was crying in pain, justifiably crying in pain, because cancer can be terrible pain, eating through the ribs, starting in the lung, and closing down the airway. So the power of radiosurgery you've heard tonight repeatedly, and these are cases just I've seen in the last few days. Cases, they're more than cases. They're human beings. They're people who are suffering, and they've been suffering even though they went elsewhere. One went to hospice. One was on chemo, surgery, robotic. Nothing helped, and came to us. Pain relief. This woman, ditto. So it might be worthwhile, if you're not getting the results that you wish. And it doesn't matter about the doctor. If the doctor is nice or not nice, don't worry about offending the doctor. Worry about you. You are the president of the United States of your body. You. Worry about you. The doctor can get over a little insult, but the patient needs to get care to shrink the cancer, to get out of the pain, to stop the infection, to stop the bleeding. That's what we're here for at Radiosurgery New York, a private cancer treatment center in the heart of New York City, close to most trains, subways, buses, Penn Station, Grand Central, Port Authority, PATH. We take most insurances, Medicare, Medicaid. We respond to your calls. You won't get an answering machine. We don't have students, but real doctors taking care of people who need care. Hey, there's an article in the Associated Press about women who are getting double mastectomies. There's this trend, and no one can figure out exactly why. Some women are choosing to remove both breasts, even if they have a little cancer in one breast that could be treated with removing the lump and then a shot of radiation. So why are women doing this? Well, some women probably think that if they remove both breasts, they'll be better off. So there's a study that's looked at that. And finally, we can give you an answer. This is an article by Leslie Tanner in Associated Press. Removing, and this is her words, removing both breasts to treat cancer affecting only one side does not boost survival chances compared with lumpectomy. This was a large study. The results raise concern about riskier, unnecessary surgery that many women are choosing. The study involved 200,000 women from California, followed for cancer in one breast, and then studied years later. The survival rate is no better if you have double mastectomy. You don't need double mastectomy. There's no benefit of double mastectomy. You can have the same likelihood of being cancer-free by having just a lump removed for most women. There's never always or never in medicine, but for most women, and having some radiation to the breast, you most likely will have an excellent looking breast. You probably will even forget about the cancer because you won't have that difficult reminder, the mastectomy or double mastectomy, to remind you every day of that cancer. I can tell you that in my experience over 30 years, women are generally very pleased keeping the breast, I believe much more so than having mastectomy. So we know, of course, some women don't have the chance or the choice, but for most women, there is a choice of how to treat the breast cancer. And with us, I'm not a surgeon. I don't have a motivation to do unilateral mastectomies or bilateral mastectomies. My motivation is to provide the best care and advice for each patient, man, woman, or child. And if a woman hears that the results are the same, just removing the little lump of cancer and keeping your breast, isn't that a lot better than doing a double mastectomy? And by the way, the complication rates are much higher with double mastectomies. So you're avoiding the high complication rate. You're avoiding a lifelong of living without the breasts or the sensation of the breasts. And even reconstruction is never the same as what God intended you to have. So if you have my advice is look at the data, and the data says you're better off keeping your breast. If you have a lump or bump in your breast and you're afraid to come in, please come to us. We'd like to see you. We'd like to talk about all the options. And sometimes you can make a diagnosis to relieve all your anxiety with just a little needle in the breast, find out what it is, and send you on your way with good news and good treatment. So that's what we do at Radiosurgery New York. Again, my name is Dr. Lederman. You can call us during the work week at 212-CHOICES, 212-246-4237. If you'd like to speak to us on the show, you're welcome to do so. We are live, 1-800-321-0710. This is Dr. Lederman. Here we go.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES, 212